Complications. Medical risk factors for dementia include the following. Atherosclerosis is the thickening and hardening of artery walls due to plaque buildup. Plaque is made of cholesterol, fat, calcium, and other substances in the blood. This buildup can narrow your arteries and interfere with the flow of blood in your brain. This impairs the ability of your brain cells to function properly. This can ultimately lead to the death of these brain cells and the connections to the other brain cells. The high cholesterol levels increase patients' risk of developing vascular dementia. This may be due to association between atherosclerosis and high cholesterol. Homocysteine is an amino acid naturally circulating in the blood and is a building block of protein. A high level of homocysteine is a risk factor for a number of diseases, including Alzheimer's disease, vascular dementia, cognitive impairment, and strokes. Diabetes may be associated with increased risk of developing both AD and vascular dementia. Diabetes is also a risk factor for atherosclerosis and stroke. Both of these can contribute to vascular dementia. Psychological and experiential factors may be a risk factor for dementia as well. For example, if patient tends to socially isolate themselves or don't regularly engage in cognitive stimulating activities, patients may be in increased risk for developing AD. Mild cognitive impairment can be thought of as a stage between normal forgetfulness and dementia. However, if patients have MCI, which is mild cognitive impairment, it doesn't mean that patient develops the Alzheimer's. But most cases of Alzheimer's start with MCI. Symptoms of MCI include memory loss greater than expected for patient's age. Memory deficiency is great enough to be noticed and measured. Continued independence because the deficiency isn't enough to compromise patient ability to care for self and conduct normal activities. And last but not least, the Down syndrome. By middle age, most people with Down syndrome have the plaque and tangles of Alzheimer's disease. Many also develop dementia. There is also genetic and lifestyle risk factors for dementia, which includes age, genetics, that is non-modifiable factors. Also, smoking and alcohol use can also contribute to development of dementia.